There are some good legislators on Capitol Hill who want to do the right thing. If the people demand it, there's momentum. They'll get HR676.
Ladies and gentlemen, brothers and sisters, welcome to this very important Universal Healthcare Forum. Thank you all for coming.
It's not going to be enough in the next 12 months just to say, I believe in healthcare for everyone. That's not enough. That's not enough. You're going to have to tell us very specifically what you're going to do to remove profit and greed from the system and put the system in the hands of the people of the United States of America. That's what we want to hear, and that's what we expect.
As a future physician, I have to tell you all that I am very, very terrified to graduate medical school and go out there and practice in this failing non-healthcare system that we have right now.
When you are a modern, industrialized nation and you have 47 million uninsured men, women, and children, that is a healthcare crisis. It's not a crisis that's coming.
I've seen a man lose his leg because he couldn't afford antibiotics. I've seen children getting inadequate care because they have Medicaid as opposed to a private insurance.
I'm terrified because in 2 years, I have to take an oath. I have to take a note that says that I'm going to do no harm and I'm going to provide the best health care out there for my patients.
We are the only nation in the world with a health care system based on avoiding sick people.
I'm terrified because I know that's impossible. How is that possible when the majority of my patients cannot even afford health care?
We practice in our financing system the equivalent of medical apartheid in America. That's how we practice medicine in America, and we have got to stop doing this.
This is the most important piece of legislation, the notion that everybody in the United States will be covered by one plan, single payer, from the day they're born till the day they leave this earth. That is the major goal of my whole career.
The American public is ready for this. They've been waiting for the opportunity. This is an issue that affects all Americans, regardless of their political stripe. When you get sick, sickness doesn't know Democrat or Republican.
As I travel around this country, where we will be challenging all of the presidential candidates, it's going to be on out of Iraq and universal health care, and we don't want any nuancing. We don't want people talking around it. We don't want people being intimidated by the insurance companies.
We, as nurses, have made a commitment that we will fight tooth and nail to make sure that we have single payer, the Conyers bill, passed in our lifetime.
We are united to accomplish health care for all, universal, single payer, not for profit health care.